Welcome to VPT's tips on how to move free and be pain-free. Our topic today is MRIs. We get the question all the time, don't I need an MRI to be properly diagnosed or before I start therapy? And the answer is actually no. We have overused MRIs, and this has only led to prolonging symptoms and even increased rates of surgery and chronic conditions. MRIs were developed in the 1980s and absolutely revolutionized our ability to see structures. But they don't diagnose, and they can't differentiate painful from non-painful structures. By the time you're 50, you have an 80% chance of having degenerative disc disease and multiple disc bulges without symptoms. Again, this is just the normal aging process. So when you do have a gray hair on your head, expect it to be normal that your joints will also show some aging. MRIs are simply a picture. They can't diagnose or differentiate painful from non-painful structures. It would be the same as taking a picture of my cell phone. You might see that my screen is cracked, but you can't tell if there's water damage or if the phone actually works. Only by using the phone can you tell if it's functioning properly. And that's the same for our musculoskeletal system. Only by using and moving the joints can we determine the root cause of the symptoms. A recent study found that over 42% of isolated extremity symptoms actually originate in the spine. And what that means is that you could have just shoulder pain, and you can go in and demand an MRI of your shoulder. And the MRI more than likely is going to find something. But you have over a 42% chance that your symptoms actually originate from your neck or your low back for your lower extremities. So it is imperative that you, instead of demanding an MRI, you demand a mechanical assessment so we can determine the true cause of your symptoms rather than misdiagnosing you based on an MRI. In 2006, a study was performed where they gave a group of surgeons MRI results of patients with arthritis or spinal stenosis and degenerative disc disease. The surgeons were asked if they could determine which patients were complaining of pain. They were not able to. The amount of arthritis in your spine has no correlation to pain. In the early 90s, when MRIs became really popular, our surgery rates boomed. Replacements were up by over 100%, and spinal fusions over 600%. But unfortunately, we weren't making patients better. Chronic conditions only increased. Again, MRIs have a very high value when used properly. They need to be reserved for patients with red flags or symptoms that are out of line with common musculoskeletal problems. At that time, we do an MRI to see if there's anything out of the ordinary. But if we continue to practice doing an MRI on everybody with pain, we're going to be overdiagnosing and misdiagnosing so many patients, and our chronic pain will continue to escalate. Thank you so much for joining us. And if you have any questions, please get in touch with us. And remember, move free, pain free, VPT.